Collaborative, optimizing antibiotic stewardship in skilled nursing facilities. The OASIS intervention is a comprehensive organization-level intervention designed to improve antibiotic prescribing in participating skilled nursing facilities. Previously on OASIS, we've talked about why antibiotic use in skilled nursing facilities matters, how skilled nursing facilities affect antibiotic use, and the pre-prescribing component of the OASIS intervention, which is a change in condition form that can be used to structure communication between the nurse and the prescriber and promote active monitoring when appropriate in low-risk changes in condition. In this video, we will talk about the nuts and bolts of the Antibiotic Review Form, which is the post-prescribing component of the OASIS intervention, and we will present clinical scenarios to illustrate how the form can be used in a variety of situations. The OASIS intervention modifies the structure and desired processes in skilled nursing facilities related to antibiotic prescribing by modifying tasks, tools, and organizational influences to delay testing and treatment of residents with low-risk changes in condition and to identify opportunities for post-prescribing antibiotic review and optimization in order to reduce antibiotic starts, reduce antibiotic duration, and narrow the spectrum of antibiotics prescribed whenever appropriate so that we can reduce events of C. difficile and antibiotic resistance. The four components of the OASIS intervention are pre-prescribing and post-prescribing at the frontline staff level, and process checking and performance monitoring at the organizational level. The purpose of this video is to focus on the post-prescribing tool, which is an antibiotic review form that improves communication between nurse and prescriber and promotes antibiotic de-escalation when appropriate. The process that the antibiotic review form promotes is whenever an antibiotic is started, if it is started by the primary care provider, then we want to schedule a post-prescribing review within 48 to 72 hours to identify opportunities to modify the antibiotic prescription if appropriate. If it was not started by the primary care provider, we want to make sure that we notify the primary care provider that an antibiotic was started on a resident that they were covering, as well as scheduling a post-prescribing review with them. Once we have a post-prescribing review scheduled, we want to assemble pertinent data for that review, including resident condition, microbiology results, and other laboratory test results, as well as imaging test results. During the post-prescribing review, the nurse and the primary care provider will collaboratively identify opportunities to make decisions on whether the antibiotics can be stopped, whether the antibiotic spectrum can be narrowed, and whether antibiotic duration can be shortened. The core of the antibiotic review form is a decision support tool that has two sections. One section that is filled out by the nurse in the top of the following diagram, and one section that's filled out by the provider at the bottom of this diagram. These sections can be filled out in advance of the antibiotic review, which may be conducted by phone or in person between the nurse and the prescriber. There are three antibiotic modification pathways in this diagram. The first one leads to identification of opportunities to discontinue therapy when appropriate. The second one includes opportunities to change therapy when appropriate, including narrowing therapy when needed. And the third one includes opportunities to shorten the duration of therapy when appropriate, and there is information available on the form on rationale for shortening and for what may be an appropriate shortened duration. And now we will talk about examples to illustrate how this form is used in practice.
It may help to have a copy of the Antibiotic Review Form in front of you for reference as we work through our examples. As a review, the basic steps of the OASIS intervention antibiotic review process are reassess the resident, complete the antibiotic review form, conduct the antibiotic review, identify opportunities to de-escalate the antibiotic order, and modify the order if appropriate. Previously, on the OASIS intervention video, Change in Condition, Mr. Dean returned from the emergency room with an order for Cipro. He fell while getting out of bed and cut his arm last Saturday night. Staff called the covering physician, who gave orders to send Mr. Dean to the emergency room for evaluation. He returned hours later with sutures in his arm and an order for Cipro, 250 milligrams every 12 hours for 10 days for a diagnosis of UTI, urinary tract infection. Mr. Dean had no signs or symptoms of a UTI prior to going to the emergency room. The documentation from the emergency room did not identify any signs or symptoms of a UTI either. The nurse called and spoke with the emergency room staff, who stated the diagnosis was based on the urinalysis results. On Monday morning, nursing staff called Mr. Dean's primary care provider and informed him of the above. They also scheduled an antibiotic review for Tuesday morning. Shortly before the antibiotic review was scheduled, the nurse reassessed Mr. Dean and completed the antibiotic review form. Notice the arrows across the top of the antibiotic review form outlining the antibiotic review process. Each section leads into the next. In Section A, Notify and Schedule, document when the primary care provider was notified of the antibiotic start and when the antibiotic review is scheduled. Summarize the new antibiotic order and indicate what type of infection is being treated. In Section B, document the original signs and symptoms, any new signs or symptoms, current vital signs, and any other pertinent information, including diagnostic test results. Moving on to the second page, notice again the arrows running across the top of the page. We've completed Sections A and B. Section C, Nurse Review, flows into Section D, Provider Review, which ultimately leads to Section E, Provider Orders. As noted in the upper right-hand corner of Section C, the nurse is to complete this section. In box C1, the nurse notes Mr. Dean's change in condition that was being treated with the antibiotic, the urinary tract infection, has resolved. Following the arrow to D1, Provider Review, staff are asked if there is a non-infectious explanation for Mr. Dean's original change in condition. The answer is yes, Mr. Dean has asymptomatic bacteriuria. Answering yes in D1 leads you to box D2, Stop Therapy. Stopping antibiotics when risk of infection is low reduces risk of future adverse events, resistance, and C. difficile. Completing Section C and D leads us to the last section of the OASIS intervention antibiotic review, Section E, Provider Orders. Agreeing that Mr. Dean has asymptomatic bacteriuria, the provider discontinues the antibiotic order. This is documented in Section E. There's also space for nurses' notes below. Conducting the OASIS antibiotic review 2 days after Mr. Dean started on the antibiotics gave nursing staff and the prescriber the opportunity to reevaluate the appropriateness of the antibiotic order and modify it as needed. Without such a review, Mr. Dean would have received 10 days of a broad-spectrum antibiotic, leaving him at risk for suffering side effects of the medication, C. difficile, and drug resistance in the future. Our second example is Ms. Lesher. She's 91 years old and had a change in condition with signs and symptoms of a urinary tract infection. Using the OASIS change in condition process, detailed in the OASIS change in condition pre-prescribing video, Ms. Lesher was identified as being higher risk of infection. Staff updated the provider, received new orders for Cipro 500 milligrams twice a day for 10 days for a urinary tract infection, and scheduled the antibiotic review. Shortly before the antibiotic review is scheduled, the nurse reassesses Ms. Lesher. Sections A and B are completed as in the last example. Ms. Lesher is feeling better, but not 100%. She has no new symptoms. Include pertinent diagnostic test results in Section B2. For our example, the organism is resistant to macrobid, nitrofurantoin. Her glomerular filtration rate is noted to be 48. This is an overview of the antibiotic review to help see the big picture. We'll go through each section, but notice again, across the top, the arrows show how one section flows to the next. Sections A and B are now complete, leading to Section C, Nurse Review, which will flow into Section D, the Provider Review, and ultimately the Provider Orders. As noted in the upper left-hand corner, the nurse completes Section C by checking yes or no and following the arrows throughout the algorithm. Box C1 asks if the resident's change in condition has resolved. For this example, we answer no, which takes us to box C2. Is the resident being treated for a UTI? Here, of course, the answer is yes, which leads us to C3. Is the urine culture negative for bacteria? In our scenario, there was bacteria that was resistant to macrobid, so we answer no, the culture was not negative for bacteria. The arrows direct us to box C4. Is the urine culture positive for bacteria that are resistant to the antibiotic the resident is on? The bacteria is not resistant to Cipro, so we answer no. That takes us to C5, which asks, is the resident on ciprofloxacin, levofloxacin, or moxifloxacin? In our example, Ms. Leisure was prescribed Cipro, so we check yes. After checking yes, the resident is on Cipro, the algorithm instructs us to go to D5 in the Provider Review section. D5 asks if the urine culture is positive for bacteria that are susceptible to narrow antibiotics. For our example, we answer yes, it is susceptible to narrow-spectrum antibiotics. It is only resistant to macrobid. Following the arrows after answering yes to D5 takes us to narrow therapy, D6. Switching to narrow-spectrum alternative will reduce the risk of Clostridium difficile. Picking up again at narrowing therapy, box D6 on the right side. Following the arrow after D6 directs us to the section titled Narrow Antibiotic Therapy, below Section D. The provider considers changing the current order for Cipro, a broad-spectrum antibiotic, to a narrower-spectrum antibiotic, taking into consideration the culture sensitivity report and this guide listed on the Antibiotic Review Form. The form asks if the resident's estimated glomerular filtration rate is greater than 50. In our example, the answer is no, which leads us to asking if the resident is allergic to Bactrim. If not, consider switching the antibiotic order from Cipro to Bactrim. Looking again at box 6, in addition to considering narrowing therapy, we are instructed to go to box C6. Box C6, on the far right upper corner of Section C, the Nurse Review, asks if the resident is currently scheduled to receive more than 7 days of antibiotics. In our example, Ms. Lesher's order was for 10 days, so we answer yes. Following the arrow to C7, it asks if the resident is being treated for a UTI, bronchitis, pneumonia, or cellulitis. Answering yes, since Ms. Lesher is being treated for urinary tract infection, we follow the arrow to C8. Is the resident's change in condition improving or resolved? Here, she's improving, so we answer yes, which then directs us to box D7 of the Provider Review section. Box D7 states that a majority of nursing home infections can be safely treated with 7 days or less of antibiotics. When you follow the arrow from box D7 to the box below titled Short Course of Antibiotic Therapy, 7 days or less, it gives references to support this recommendation. Once Section D, Provider Review, is complete, we proceed to the last step, Section E, Provider Orders. In our example, opportunities to both narrow the spectrum of the antibiotic and to shorten the length of the antibiotic therapy were identified. Broad-spectrum Cipro was changed to the more narrow-spectrum Bactrim, and the course of therapy was shortened from 10 days to a total of 7 days. In summary, by using the OASIS Intervention Antibiotic Review, once Ms. Lesher was identified as having a change in condition and antibiotics were ordered, the nurse reassessed her and completed the Antibiotic Review Form. The antibiotic review was held 48 hours after the start of the antibiotics. Opportunities were identified to both narrow and shorten the course of antibiotics. Using the OASIS Antibiotic Review provides another opportunity to evaluate the appropriateness of the antibiotic order. You may be able to discontinue the antibiotic, narrow the spectrum, or shorten the duration of the antibiotic therapy. In this video, we've addressed the Antibiotic Review Form and how this form prompts a review of antibiotic prescriptions, consolidates relevant clinical information, and provides a pathway for facility staff and prescribers to identify potential alternatives to improve resident safety and minimize harm. For additional information on the change in condition form, the pre-prescribing counterpart to this form, including examples of how it is intended for use, the background and history, see the other videos in this series.